Hey everyone, welcome back. Today we're doing a deep dive on something that's pretty universal: cataract surgery. Whether you're facing this yourself or maybe you're just curious about, what happens when our eyes get a little vintage.
A little fuzzier.
Yeah, exactly. This one's for you. We're going deep into the science, the surgery, even busting a few myths along the way, all based on that article you sent. Thanks for that, by the way.
It's a fascinating topic.
It really is. Okay, so picture this. Your vision, it's slowly getting cloudy, almost like someone smeared Vaseline on your glasses. Annoying, right?
Saying that.
The worst. Well, that's essentially a cataract. It's what happens when the lens in your eye, the part that helps you focus, well, it gets cloudy. But why does this even happen? And is it really as simple as, like, swapping out the old lens for a new one?
Let's find out.
Exactly. Okay, before we get to the surgery part, let's break down what we're dealing with here. What's the deal with cataracts, and how do they actually mess with our vision?
So, you know how a camera needs a clear lens to take a sharp picture, right? Well, the lens in our eye is pretty similar. It sits right behind the pupil, and its job is to focus light onto the retina. Think of that like the film at the back of your eye.
Makes sense.
Now, a cataract forms when proteins in the lens, they start clumping together, making it cloudy. Suddenly, that lens isn't so good at focusing light anymore.
Ah, so it's like trying to see through a frosted window.
Exactly. Things get blurry, colors fade, and everyday stuff driving it becomes a real pain. And get this, it's incredibly common. By the time most people hit 80, they'll have some degree of cataract development.
80. Wow. Okay, so it's like this slow march towards cataracts for all of us.
Pretty much.
Makes this deep dive even more relevant. Now, the article mentioned cataract surgery being an outpatient procedure, which honestly sounds way less scary than I imagined. But let's demystify this. What actually happens during the surgery itself?
It's really much quicker and less invasive than people think. We're talking about an hour, usually, for the whole thing.
Wait, an 8-hour? Really? I mean, it's eye surgery, not a quick oil change.
I know, right? But it really is that advanced, and it's not like they're, coming at you with a scalpel. This is microsurgery, super precise. They make a tiny incision and use this technique. It's called phacoemulsification. Basically, they use ultrasound waves to break up the cloudy lens.
Phaco what? No. Okay, I'll admit that sounds kind of intense.
That's a mouthful, I know. But basically, think of it like a tiny high-tech jackhammer, but for your eye.
Okay, that actually makes it much easier to imagine. So they blast apart the cloudy lens, but then what?
Once it's broken up, they gently suction out those little fragments, and then they replace it with an artificial lens. Think of it like a permanent contact lens, but one you never have to take out. This new lens helps restore clear vision.
So you're telling me they remove this tiny, delicate part of my eye, replace it with a manufactured one, and I can just walk out and go home?
That's the general idea. You'll need a chauffeur for the ride home, of course, and you'll have some post-op instructions to follow. But the recovery is generally much faster and less painful than people think.
Okay, speaking of pain, let's address the elephant in the room. It's the eye. How uncomfortable are we talking?
Oh, no, it's a question everyone has. But the article was actually very reassuring on that point. Before anything starts, you get numbing eye drops, so you don't feel pain during the procedure. You might feel a bit of pressure, but not actual pain.
That's good to know.
And afterwards, over-the-counter pain relief is usually enough.
That's a relief. But what about all those things you hear about not being able to do after eye surgery? There are a ton of myths surrounding recovery.
Oh, the myths. People think you can't, sneeze for a year after cataract surgery.
I know, right? It's like everyone's great aunt has a story. So let's set the record straight. What does recovery really look like?
It's a lot less dramatic than you'd think. Easy for a few days, no rubbing your eye, use the drops they give you. But walking around, watching TV, even a little reading, that's all fine.
Okay, so no marathon running or bungee jumping for a bit. Got it.
Exactly. Nothing too strenuous. No driving until your doctor gives you the okay.
Makes sense. But things like, say, showering or washing my hair, can I do that right away?
Good question. You'll want to be super careful about water or soap getting in your eye for the first week or so. Your doctor will give you specific instructions on how to keep the area clean, though.
Okay, makes sense. Now, we touched on this a bit, but let's talk vision improvement. How long until I can actually, see clearly after surgery?
Most people see a difference within, a few days.
Oh, wow, that fast.
But it can take a few weeks, even a couple months, for your vision to fully stabilize. Your eye is healing, adjusting to that new lens. You'll have a couple of checkups during that time so the doctor can make sure everything's on track.
So it's a process, but worth it. Now, you mentioned this artificial lens is like a permanent contact lens, but is it a one-size-fits-all kind of deal? Or are there different types of lenses?
That's a great question, and it's one of the coolest parts of how personalized cataract surgery can be. There are actually several types of artificial lenses.
Oh, really? Okay, now we're talking. Break it down for us. What are the options?
Well, the most common one is a monofocal lens. It's designed for clear vision at one specific distance, usually far away. So you might still need reading glasses after surgery.
Makes sense, like choosing the right contact lens prescription, but what if you don't want to wear reading glasses? Any options there?
Absolutely. That's where you'd look at multifocal lenses or accommodating lenses.
Multifocal accommodating. Sounds fancy. What's the difference?
So multifocal lenses, think of them like bifocals, different zones built right in.
Ah, I
You
see.
can see clearly at various distances. Accommodating lenses, they're designed to mimic how your natural lens focused, but they're not as common.
Wow, so you can actually customize your vision correction during the surgery. That's wild.
It's pretty amazing. But the type of lens that's right for you, that depends on your needs, your lifestyle. Your doctor will help you weigh the pros and cons of each option. It's very individualized.
This is all so fascinating, but with all this talk of artificial lenses, high-tech procedures, it almost sounds too good to be true. Are there any risks or complications we should be aware of?
It is. But you're right, with any medical procedure, there are going to be some risks involved.
Right, of course.
But it's important to remember those serious complications. Those are actually pretty rare.
Okay, that's reassuring to hear. But when we say risks, what are we actually talking about here?
So some things that could happen, though again, uncommon, include things like infection or inflammation. There could be bleeding, maybe some swelling in the retina. In rare cases, you could even have retinal detachment. I know these sound scary,
Yeah.
but again, these are not common. And the technology, the surgical techniques,
Yeah.
light years ahead of where they used to be, it's much safer now.
That does make me feel better. But is there anything people can do to kind of minimize those risks even further?
Absolutely. This is where choosing an experienced surgeon, that's key. And going to a reputable surgical center.
Right, do your research.
Exactly. And of course, you've got to follow your doctor's orders before and after surgery. They'll give you those guidelines, how to care for your eye, what to watch out for.
So, right doctor, right facility, follow the rules. Got it. Now, we've talked a lot about the artificial lens, but what happens to the old one? Like the cloudy lens, once it's all broken up, it's not just rattling around in there, is it?
That's a great question, and I bet a lot of people wonder about that. But during the procedure, when they use the ultrasound to break it up, those tiny little fragments, they actually get absorbed by your eye's natural fluids.
Wow, really? So
Yeah.
the body just cleans it up.
Pretty much. Our bodies are amazing like that.
They really are. It's incredible. Well, we're nearing the end of our deep dive here, so I have to ask, what's the main takeaway you want our listener to walk away with?
I think the biggest thing to remember is that cataract surgery, it can be truly life-changing. I mean, it can drastically improve your vision, which in turn really impacts your whole quality of life.
Absolutely.
You regain independence. You can enjoy all those activities you love again. You see the world with fresh eyes.
Yeah, that's beautifully put. It's not just about clear vision. It's about, like you said, that freedom and joy in everyday life. Now, for you, dear listener, if this deep dive has piqued your interest, don't stop here. There's a whole world of information out there. For example, we talked about choosing a surgeon, but how do you actually find the right one? What questions should you be asking? Those are some things to ponder. And on that note, we'll see you on our next deep dive.